Number one, which one would be the most concerning for a beta blocker?
B.
Yeah, an upper rate of 48. Got a patient on an ACE inhibitor that has a dry cough.
B.
It is common. You should not have to stop that one, but if they had angioedema or the elevated potassium, you could. Number three, they have Coumadin or warfarin therapy. Which one?
C.
Yep, because they're already on a blood thinner, so that would just double their fun. Furosemide loop diuretic, which one would be the most concerning for loops?
B.
Yep, and did you even have to know anything about diuretic? No, like, you just know your values, you didn't even have to know anything about the drug, so sometimes you can play that way. Which insulin is gonna be 15 minutes before?
D.
Alright, cause D, your pros and your lens, or your, pros and logs are your rapid, so that's your fast one there, okay? Digoxin, I know we have not done yet, but if you researched on your own, what would be a sign of toxicity?
A.
Nausea and vomiting, so usually for dig toxicity, and that's a drug for next semester, that's on there for just extra practice, but getting you ready for next semester. If they complain of halos, like yellow, white kind of things, nausea, vomiting, dig toxicity, their body's trying to get rid of it. Bradycardia would be another one, but, number 7, you got opioid, which you're most worried about?
C.
Respiratory depression. What if neuro was on there? Which one would you pick first? Neuro. You're gonna pick neuro, because neuros is what's driving that respiratory, but it's not, so we won't do that to you. You got a patient taking albuterol, they're shaky, racing heart.
Normal.
That's normal, because remember fight or flight syndrome they will have. 9, which patient should not get atropine? Atropine, if you looked it up, is one that's gonna increase their heart rate.
B.
And so you want a patient with glaucoma to not have that because it would increase intraocular pressure. But atropine speeds everything up, or increases pressures, blood pressure. Yep, so you'll give more of that one. It's one of those vasos. Medicine for a thyroid, easy enough. Okay. What lab value you're gonna monitor for heparin?
APTT.
A PTT. Medication avoided in asthma patients? Beta blockers. I like why NSAIDs.
Because they, I'm trying to think, beta blockers do,
That's your beta 2s is for that, because obviously beta blockers block the beta 2s, which increase the chance for bronchospasm. What else? For NSAIDs, you're on the right track. It's the same thing, but it's bronchospasm too. Antidote for opioid overdose. Alright, you get Blarg and insulin. When's your next dose?
24 hours later.
Statins, what?
Grapefruit.
Yeah, pretty much grapefruit juice is the devil. Some grapefruit, and here's the fun part of grapefruit juice, it doesn't always just quote unquote block the medicine. Sometimes it makes it attach more and makes it more toxic, and I won't expect you to know that, but grapefruit juice is the devil if you take by mouth medicine. Then benzo antidote, flumazenil. This one, 17 was a throw out because, what is something that you would not want your patient taking if they also are taking nitro, which is a nitrate?
Any other orthostatic.
So what's another medicine that's gonna tank your blood pressure? If you take a nitro, which is nitrate, what else was in that ED family you don't want them to take? Give me those ED drugs. What's Viagra's generic?
I want to say that.
Sildenafil. So 17, for whatever reason, I don't know why I worded it that way or got rid of the multiple choice. But,
18.
oh, is it your 18? Okay.
Yeah.
Then a nurse is teaching a patient about nitro, you would tell them, like, so which statement's incorrect? They're like, I'll take my Viagra. No, wrong, so do not take, or you can just put, do not take other vasodilators or other ED medicines with nitro. They will not have a blood pressure. Then prednisone should report what symptom?
Of infection, fever.
Signs of infection, fever, chills, or with, bone pain, cause that sign that they're headed for osteoporosis, the bone's breaking down. Hmm?
Vision changes.
Could, but signs of infection and bone pain would be the worst two for a steroid. What medications given with food, cause it can cause gastric upset? Two that you could put in there, NSAIDs is one, and then antibiotics.
Don't ask her, she got that wrong.
Nurse given fluoroquinolone, what's your major risk?
Tendon rupture.
Tendon rupture, and so those are just, you see how easy farm's gonna be? It's gonna be that easy. Yes, it's gonna be that easy.
Not when it comes to the test.
Is the test gonna be that easy?
It'll be that straightforward.
At the end, I've heard you
So-
say that.
Well, the only reason I can't, if I gave you the answer key, I would do you a disservice, like, yes, you would pass my test, but you would tank that HESI. So I can lead you in the right direction, but I've gotta let you make the step. Hey,
So this last one, that last one, that one, medications that should be given to protect gastric?
given with food. So NSAIDs would be given with food, antibiotics would be given with food.
I put.
You reverse read it?
Editing
Yeah.
and stuff like
You
that.
reverse read it.
I put DPI.
Alright, hey, we got good questions, we might be your question. Go.
Like question, but if the last, was the last test the easiest out of all the tests we do this semester?
No, I mean, that, they're, 2, 3, and 4 are equal hardness. I just think if y'all have figured out the pattern by this point, but 2, 3, and 4 are equal. One is, and same for, the same pattern will be for summer. We always try to put your first test to be the hardest, because that way, one, if you didn't get it, you have all that time between then and the HESI to get it. And it's not gonna, I would hate to set you up like, oh, I'm doing great, and then HESI, boom, hard test, boom. So we put them at the front where you have time to recover. Also, and make informed decisions about other life choices. But your summer plan is to be jobless and homeless and live here. Because that's what you'll do. It is fine, it's 10 weeks, so just count it down. At the end of week 1, 9 to go. At the end of week 2, 8 to go. Like, it's not that bad. Resources, so.
And can we give the kids away for a little bit?
Hang on.
There are places to drop them off or something?
Camp, summer camp.
I'll send her to ask it.
Is that camp, like, asthma camp equal at Auburn?
It's not at Auburn, it's at Children's Harbor,
Yeah, but that's like,
but it's through Auburn, yes.
Oh, okay, cause I did that last year.
So when you're ready for actual, what your questions might look like on, and don't do them tonight, wait, like, go study first, and then, so that's the other thing, if you wanna bring to your mind, that's why we're gonna go over the study schedule before you go, is your EAQs should be kind of your, before, like, the end of the week, wrap up, tie a bow on it, I'm good with it, and then do the next week's lecture. Because that's how you're gonna gauge that you know the material or not. If you take it right now, obviously you're not gonna know all the answers, and Sam, go ahead. And,
I made a 78,
so you know your drugs, kinda sorta.
Yeah, kind of, sort of.
Okay.
And I wish when you go in, like y'all can let us redo it more than just one time. Even though I know we'll count more, but it's like, I love the questions. I take my
Is that
time
like
to
those
gauge
questions
where I
So-
am.
Huh?
And what I can find.
It's hard.
Also out there, do y'all remember nurses' labs?
Yes.
Yeah, but I couldn't figure out how to.
Go up there to exams, look, they have a whole pharmacology bank. And they've got them on diuretics, and oh my goodness, the kind of the major
Okay,
drug
that
classes
one's
full
better,
are
but
just
what
taught.
So for
Wow.
the section we just did, that didn't have a whole lot of that.
Hmm?
This website sucks.
That sucked for the other material we just did.
What do you mean the other material?
Like what we just got done testing on, like there wasn't a whole lot on just that, like what I was looking for.
And so what were you looking for?
I don't know, it was like the different
Give me
types.
something. Let's do osteomyelitis. I remember that one.
That's what
Looking, does not appear to be anything for osteomyelitis.
a little ad.
The registered nurse RN, she has pretty good questions.
They used to not do that, but there's a whole bank there. The other thing, please remember, you're paying for that Saunders book one.
Yep,
So
and they
down
have
at the
great
bottom,
questions too.
Or use Saunders.
Go to, I mean, EAQs, you can make your own, I'll show you how you do that in just a second. But then that Saunders review, go there. And it's gonna pull up, if you go to exam review. You're gonna go over there to study, and you're gonna look for content area, and you're gonna look for farm. And then you can actually get it down to, we didn't do any eye and ear tonight, we didn't do herbals, whatever, you can click through, maternal newborns, we haven't done psych, oncology.
We would still need to know eye and ear because that was in the last one.
Who?
We would still need to know eye and
So,
ear. 'cause we-
mainly about how to give it, not necessarily the drugs. Like, you know, pull the pinna down and back and stuff like, you know. But levothyroxine is prescribed for a client with hypothyroidism. Upon review of the client's record, the nurse notes the client's taking warfarin, which modification of the care plan with the nurse review of the client's. So before you even look at your answers, do warfarin and levothyroxine have anything to do with each other? Should. I honestly don't know that, so, but what might you have to do? What would make sense? So would we wanna change their thyroid medicine?
No.
Not in my opinion, but,
You're the expert.
I wanna hear what y'all got.
It's between 3 or 4.
Yeah, 4.
I think 3.
Who says 3? Who says 4?
It says both.
Who says anything? We're just gonna click the vote. No.
Just kidding.
It was
It was
3. And then what I like is you can hit rationale and it gives you a nice little dun-dun-dun-dun. Anyway, then go to your next one. Client's got human N subacute 8. When would you expect for a hypoglycemic reaction? I know that N is intermediate, so how long does it take your intermediates to work? So then when they gonna crash? Obviously, what are your two closest together?
I think it's gonna be 11.
Oh, you have more options.
Onset 60 to 20 minutes, peak 6 to 14. But anyway, I'm just doing this to show that if you take these over and over and over, you're gonna be able to do them just from memory. And there's only so many ways we can ask you a question. So I lived when I was a student in question world. That's, if I had 5 minutes, I went in there. And the other good thing I like about it is you can go back to study and then it should let you either do new questions or you can go back in there and reset them. And it'll because it'll keep up with ones that you've already done so you don't repeat until you're ready to repeat. I mean, live in question world. Please take questions. So speaking of study schedule, and then I'm gonna let y'all go, and y'all are still out early, and I don't know why y'all always just be like, this is holler. Like, we're doing 8, and we're doing you a favor, and I love it. So, it always hurts my feelings. I'm like, I like hanging out with y'all, I mean, y'all just always ready to like, hi. So, study schedule. Class is on what day?
Tuesday.
So we're gonna start there. So Tuesday, your goal is one job and one job only. Lecture and take notes. And so that is easy peasy. All you're gonna do that day, because most of you probably worked before you came and all that. So most of the time, when you watch a movie the second time, what happens?
Pick up on something.
You're retaining. So you're going to Wednesday morning, review lecture. So if you have time, listen to it again. Go back through your notes, condense it, whatever, because you're gonna pick up on stuff that you did not get the next time. You're gonna hear more, it's gonna stick better. The other thing that I'm missing, sorry, rewind. So Monday, what you doing Monday? Prep, and the word that nobody likes, but you're gonna do it anyway. Read. First off, you paid for it. Second, I know it's not gonna stick because like me, I'm not a reading comprehension person. I have two reading styles. One, I can read lightning speed, I get to the end, I tell you nothing about it. Or option two, I read snail pace, 4 hours have gone by and I've read maybe 2 pages for actual, can get it. You're gonna do the first option. You're gonna speed read for the because more of it actually sticks in your subconscious than you really think, because when you turn around and hear it lecture, it's gonna wake that part up again. So do you have a question or always
So
go ahead?
which book, I know,
I
which
know.
book do you
Like, I might
prefer?
answer it, but
Like, I prefer to read the.
I give you all of them.
purple one.
I give you all of them. I have no preference. The Saunders is gonna be too vague, it's not gonna have any meat and potatoes. The Potter and Perry is too detailed, it's a big time, but like, I could argue any book. So just whatever reads your brain first,
Should we just
Like,
read
I don't
what
have
you
a
have for like the module on like before class?
huh?
Like when you put like before class, like part.
That part, and a skim read, like cause you're just laying concrete. Because you're gonna reinforce with a whole bunch of other stuff. You're just trying to grab what I needed you to know on the prep work, or you're trying to just read to have some kind of understanding of what in the world are we talking about. Tuesday, your only job is lecture, and then keep the hand moving. And actually, so the people, I'm gonna pick on, the laptop people who do this, you're not getting that kinesthetic, like there is some magic to be said in actually moving the pen. It will help you remember stuff moving that pen. Cause the science that we're gonna get to is you're putting the things in your brain in multiple places. So when you read, it's going in your cerebellum. When you hear it, it's going in your temporal lobes. When you kinesthetic, it's going in muscle. You're putting it in multiple places. So when you take your test, instead of having a blackout and you only have that one read, because I only took questions or I only listened to lecture, I didn't do anything else with that content, you have one singular point to pull that information from. Where if you're putting it everywhere, and so if you think about it this way, you're spending the same time, but you're spending little increments every day in it. So you're kind of marinating the whole week. So you're aging in it. And so after Wednesday is gonna be review lecture, condensed notes, and my pen died, so let's pick a note. You're gonna condense your notes to be a little more digestible, because you know as well as I do, if you took around your book, the PowerPoint, the notes you took, that's a whole lot of stuff. So you're gonna condense your notes down. So after you condense your notes, then Thursday needs to be your review day. So this is where you're going to make a summary sheet, flashcard, whatever your gimmick is. So instead of carrying around all of that stuff, you're literally gonna make you an 8x11 sheet of paper with the big 5 on it. So, because that's what we're worried about, is those risk factors, signs and symptoms, treatments, labs, diagnostics, patient education. That's gonna be 85%. And then the extra stuff you're gonna stick on there is, I saw that caution sign in the Saunders book that said, don't give warfarin with, or don't give your patient leafy green vegetables or something, you just, whatever the big caution sign said. Or Mr. McCarty's like, I want you to really know this slide, or I want you to, Fuller said highlight that star, big takeaway. That's your test. 85% is your big 5, the other 15 is gonna be the stuff we told you to underline, caution sign, look at that table, whatever. And then if you got that on there, there's all your stuff. So then, Friday is gonna be some sort of activity day. So this needs to be your study buddy group, be it a Zoom group, an in-person group, teach your kids, teach your dog, but you need to do something vocally to get it out that way, because that's gonna put it in your vocal center, which is in your Wernicke's in front. So anyway, I'm gonna just put something vocal. Teach it, study buddy, whatever, get it out there. And then Saturday, Sunday is you're gonna be your quiz off, and that's all you're gonna do is quiz and questions. And then, so if you did good on the quiz when you took the EAQ, you're good to go, move on to the next chapter. If you took that EAQ and it's a 50, 60, not good grade, then you need a tutor, and we need to come figure out why is the content not sticking, what you study, what resources, all that kind of study-based stuff. But if you look at that, it's a different medium every day. So one, it keeps it fun, because it's gonna change it up from you just dragging a book, and putting your head in the book, because, you know, that's old at this point. So it keeps it fun, it puts it in different parts of your brain, and it actually makes you have to know something, because for you to do that, you have to know it. So it's in there, and there's no, but like I said, if you're doing good, keep doing what you're doing, but if you're not,